So here we are on this little makeshift show that I'm sure is what's on everyone's minds is something that's going on around. We don't even need to mention at this point, but I figure we just get this right off the bat with, first of all, I guess my front of the triangle. I guess we have this triangle set up.
6 feet.
6 feet.
Yeah, 6 feet.
Social distancing.
Yeah, and when the numbers go up, if they do, then we will just do it like digitally next time.
We'll be right. Yeah, we'll be like CGI.
Yeah.
But we're here. We're following the mandate here. DJ Pachi is to this way of me, however that looks. DJ Pachi, everyone, house music DJ extraordinaire. Finally on the show. I would wish it would be on better terms, but you are here, and you're also a medical professional.
Yes.
And that is why this man is here. Did you want to expand on what medical professional specifics you are?
Yeah, so my background, I was at first a medical laboratory scientist, so people want to do all the blood tests. Then I went back to grad school and became a clinical pharmacist. So right now I work as a clinical pharmacist.
There you go.
Yeah.
And then to the man of the hour, the man that is thankfully joining us here tonight, Dr. Ali Chisti.
You can tell me Ali.
Oh, okay, we're not going to go doctor. Okay.
I mean, they already know. Patients already know. I mean,
of course,
emphasize it.
Right. You're all over the media. You're all internal medical doctor of a big hospital on Oahu. I'm not saying the name. And Master of Public Health, Harvard, Oregon was your
medical school.
Medical school,
yeah.
Yes. And you've been here practicing for how long?
6 years. 3 years in residency, which was at University of Hawaii, JABSOM, which primarily Queens Punch Bowl and Kwakini and Straub.
Yeah. Nice. So let's get right to it, sir. Let's go to the topics happening today. Let's go to the most current stuff. Now, several things came out, and I know you wanted to touch on this. Of course, social distancing. We'll be saying that a lot. Let's go with, first of all, Daniel Dae Kim. Let's start off with that. Now, he came from New York is the story here.
Amazing guy. I love his stuff.
National treasure.
Shout out
Daniel
to
Dae Kim.
Incredible person.
I never was a fan.
Wow.
So what is your thoughts on a guy like him now who came back from New York? New York was a lot of cases in New York, and he just self-quarantined. What was the story here with him?
Well, I mean, I hope he's doing well. I mean, he just posted this morning, and he's probably going through a lot of anxiety. And so, first of all, I hope he's well. I hope he's recovering well. Yeah. I think it just kind of shows the national issues with, it's not really international people coming over either. It's the fact that this is in the United States as well. And so, I think it's important to think about. I mean, today's been a big day, right?
A lot
with
of
like Lieutenant Governor Josh Green putting out that. I don't know if people know about that.
Finally has I think we posted it up there on Instagram and whatnot. But the official lineup of what needs to happen.
Yeah.
Let me pull this up here.
That's his want list, right? That's what he wants to do.
To defeat it, right?
And that came from a lot of like medical providers and doctors over the last week, kind of brainstorming together and people on the front line. And he already knew that stuff, but he spoke up a lot louder today, which was awesome. And people are listening. It's scary, when you see on the news like 14 days this, shutdown this.
Right.
We could talk about that.
Right, and well, let's go down the line here with what he in fact came out with. He, number one, suspend all non-essential travel to Hawaii through April 30th. Mm-hmm. That was the first thing here. Anyone who comes to Hawaii gets 2 weeks quarantine. We contact test every positive case and isolate them completely. We continue to study the states that are 2 to 4 weeks ahead of us to prepare for all of our needs. Extra hospital capacities. The second we see it could help with military support. And screening at airports, millions more masks and swabs. I mean, it's stuff you guys definitely going to need. And should have this been done earlier? Should have this been done in the beginning of March here? Now,
well, Chris sits at the front of the emergency room. So, like, when they're in, the doors open and people come in on the stretchers, and the gust of wind comes in, he's right next to the TB isolation room. Which is also
I sit in the respiratory room. All the rooms are all the respiratory patients.
What do you think, Chris? You're the one who's sitting right there in the front.
Yeah, I mean, I think nationally we should have started earlier, and locally, I mean, probably should have been done a little bit earlier, but I think we're doing the best we can right now. But I think if you want to talk about maybe overall, maybe nationally it should have started earlier. Well, I don't know. What do you think?
But I mean, and there's something to that. Like we're not alone in this. I think you and I were freaking out last weekend as things were coming in, and we had to revamp things together. But we weren't alone in that, you know. And people were listening, and that's good. And I think as an ER pharmacist, you're right there, like in the action, which is advising all the doctors. All the ER doctors use one ER pharmacist is right there. So
right, and that's kind of what started this whole thing with your great Facebook posting. That
should we talk about why the phone is buzzing off?
that's the government right now. They're going to shut this down.
Yes, because Kamiki Superette, they're taking all the calls for the take-in orders.
Oh, that's right.
Takeout orders. Yeah.
Okay, we have to possibly leave the
this
phone
is
off.
real.
This is real
life.
That's for the people watching, right? Let's go into this as far as all the local businesses that are happening. Here we are live in Mud Hen Water. We are closed. This is closed to the public here. They're doing takeout next door at Kamiki Superette, much like all the restaurants are.
Yep.
To-go delivery.
Yeah.
And the reason why we're doing it here is because, the guys next door at Ed Kenny is both the same owner. He on Monday he was like, "Oh, we got to shut down indefinitely," and then a couple of days later he's like, "Let's try and innovate," and he started bringing everybody back to work, started making food to go. Yeah. Which uses our local farms, gets people back to work. Exactly. It's harder here. Like in Italy, you shut down all the restaurants and all the bartenders. They get health insurance. It's different over here. Like we're a whole different game.
You're not getting nothing.
So it's a big deal trying to get people working back to work.
Yeah.
I mean, sure, you can get unemployment, but I don't know. Not everybody claims all their taxes.
That situation.
Or their tips and stuff. So.
Right. So it's sweeping. Everybody knows about it. Sweeping all over the island. Delivery, takeout, to go. All these restaurants. There's another order now. See, all these people are coming. We got wires breaking. This is like back like World War II days. I think we're in a bunker right now. We're a speakeasy right now.
Yeah.
So it's starting tomorrow, 8:30 a.m. for 15 days. Yeah. Right. That's the no seating.
Right. So let's look at what also happened today as far as of this Friday. I guess it's now official. All restaurants will close and go strictly to takeout, delivery. Everything is closing as of Friday.
Yeah.
2 weeks. So
all restaurants, all bars and nightclubs.
Right.
Also.
And that's just there's a general anxiety across the entire United States about this situation. You saw California went full lockdown today. Yeah. So, the quicker we act, the quicker we do this, the quicker we stop the transmission between all the tourists are here and all the young people working, the faster we can get people back to work. And so it sucks. I can't even imagine what it's like to have your job pulled. But it's really like going to get people back to work sooner. The faster we are isolated, the faster we're not transmitting the disease.
Right.
Exactly. Everyone is affected. There's not one person that's not affected on the island right now. Clearly, right? So
not infected, but affected.
With an A.
So
not the scary.
We don't know yet.
We need to be very clear.
But I think it's interesting to
using an A.
Younger people can be vectors, which means they can carry the disease. But and everyone's can't be harmed. But there's a study this morning out of Medscape. 20% of the deaths that we've seen in the United States were in the age group of 20 to 44, and that number's changing. Right. This morning was 120 deaths total, and that's well over 180 on New York Times now.
I definitely want you to expand off of that, because you sent me that article this afternoon, and pretty much the main theme of this whole situation is you want to get message out to that demographic, to that younger generation. So
I'm 33. I should be in that generation. I'm not that much older, but
you look younger, but
you're right in the middle of that.
Yeah. So I am part of that generation. I am the one who's supposed to go to Europe on Wednesday, and we canceled our trip.
You should be at Florida right now on the beach yelling at the rest of those holidays. But if you could say right now, because you have them listening, watching, what have you, what would you kind of drive and nail into their brain that needs to be done right now?
I don't think we need to pick anybody out because they're doing a good job. It's hard because what is social distancing? Okay, 6 feet. Well, I can still be in a pool and 6 feet away from somebody else. And so it's but, and that's, so we don't really want to shut down everybody's lifestyles. They said no beach. I think beach is okay as long as you're 6 to 10 feet away from people. It's really like a moving target here. But I think probably people are blaming millennials. That's what some millennials feel, but I don't think I think they're cognizant, they're aware, and they move the quickest of anybody to adapt to situations. And so are we.
Right. Driving around today, Pachi, I don't know if you're driving around, but running around, right? We're seeing people all over the streets. We're seeing people all over, and it's usually younger and then elderly. No in between that I encountered. Why is that? As far as around,
I think it's because we haven't really stopped people from working. Everybody, not every institution is work from home. So then he's either on school break, or you're retired or something else. And so it's like a kind of a dilemma. We cancel the schools. Are we going to get people working from home? As much as we can, because then otherwise you get all the kids who are carrying it hanging out with the elderly. And so
exactly, they're all hanging out.
Multi-generation homes, just like Italy. So
right. That's what we're seeing.
I think too that some of the younger, maybe the younger like professional age people too, maybe have more flexibility to be able to work from home. Yeah. Maybe their jobs are more, can lend to that more. Versus maybe people who are living on the older generation, their jobs are more they're more like the manager or the boss has to be at the place. So maybe the younger ones get to like stay home and work from home.
But it's not like a zombie apocalypse. Like you can go on the street.
Yeah.
You can walk your dog. Like those are good social distancing things.
Yeah.
So I think like, they're really good at making things go viral. So like, posting what you're doing with social distancing, like I don't know, for me, it's like playing golf or like whatever, like going on a jog where you're distancing from people or, you don't have to be fully locked down. It's not jail.
I think too, it's good it's good if people understand transmission.
Yeah,
like
what are the risky things?
What are the risky things to do? How it's actually transmitted, and then that way you can kind of make your own decision as far as like, if I do this thing, what kind of risk does it put me into? Yeah, it's some people are so black and white. Like, I'm gonna have to say 6 feet from you at all times. Have like that big circle around them.
But if you touch the same door handle, that somebody else touched like 5 minutes earlier, that's way worse than being within 6 feet.
Yeah, exactly.
So plastic can carry the virus for 72 hours.
You make a good point here because I saw something new came out of that regarding stainless steel, copper, plastic, paper. How long does it last? And did you hear about the time frame that it lasts on? Still?
Yeah, this was like
a couple days ago.
New England Journal of Medicine. And it's just important to show they're trying to understand like airborne precautions and whether or not wear a droplet and surfaces. And, it's just something to be conscientious of because social distancing or like trying to do more. I mean, FaceTime is good, like you don't have to be like socially isolated. But really, like you go and sign a pen at a restaurant for your takeout, just carry your own pen. Don't use the pen that they have. But kind of like no brainers. I don't have to go through the list.
These are all logical awareness.
There's YouTube videos of people where they have like stuff on their like chalk or something, and it shows what they're touching, and that's kind of cool. I mean, intuitive.
And also, if you can't get out of that situation where you have to touch something or you have to do something that might break that that concept of like staying distant or staying clean, immediately go and wash your hands.
Right.
Don't wait. Don't touch your face. Some ways you can't get away from it. I think like if you have to open a door handle, only way to get in is to open the door handle. Then open it, but then don't touch your hand, don't touch your face, and go right away and wash your hands. Maybe I don't know. Maybe that would be a good. Yeah. If you can't get away from certain things.
No, is that really the primary thing we look at as far as what is the number one preventative measure for this whole thing? Is it really just washing your hands, don't sneeze in anybody's faces, and just that type of logical common sense hygiene? Is that it?
Kind of. I mean, it's complicated in that now the cat's out of the bag. We got people getting ill, people falling sick, people dying. Not here that we've documented any issues yet, which is good. So yeah, I mean, the way you transmit it, it's just like any other virus. People understand viruses, I guess. Like I saw some questions about influenza versus this, and Chris can speak to that too.
Like there's airborne versus droplet. Maybe that's something good to explain to people about
particle size.
Yeah, particle size. So airborne. The thing is, airborne, it can, if you breathe it out, it'll correct me if I'm wrong. It can hang in the air for like hours.
If there's no circulation, if it's a closed area like an ICU room, hopefully.
But breeze, of course, will blow it around, even a slight amount. But theoretically, if there's no air movement, it would hang out in the air, and as you walk through it, you breathe it in, and you could potentially get it from that.
Hours.
Yeah, hours. Whereas droplet would be more like it's sort of a bigger particle size, so as you blow it out, kind of can travel, but it eventually kind of fall down like faster.
Slow-mo sneezing videos.
Yeah, like those slow-mo sneezing videos where you see all that stuff, imagine that like in regular speed, it can go pretty far, but it'll like sort of land on a surface, which then you can touch it after that.
Right.
So, you know.
But then you have like runny nose people kind of like
Right.
One of the problems with
right,
people
touch
with
face.
really strong immune systems theoretically, like, you know,
Right.
not being fazed by it.
Right.
Yeah.
Right. I think that came up a question. Got a lot of listener questions here. So let's go down the lines in regards to what we're talking about now. Paper, envelopes, checking the mail. How does the virus transmit through paper? Is it transmittable through paper? Does it last long on paper? Are we to not touch our mail anymore?
I mean, I've looked this up.
I think, for what it sounds like the longest if it can survive on something is like would be like at most in the best situation on the metal and plastic, I think, right? Or plastic was a couple days, right?
Yeah. Well, so like Anthony Fauci, he's the director of the Health's infectious disease. So he's basically the highest ranking infectious disease person in the United States, direct advising, helping us fix this situation.
Yep.
He addressed this last night. There's interviews on YouTube, JAMA, JAMA, and then they do it it's actually meant for physicians and healthcare providers. So it's kind of like, it can be a little like esoteric, but like it's really helpful. And he was addressing, if we ship stuff over from China, are we going to get it from? No, because that study in cardboard and paper is like maybe 2 days. But that's if it's like a high viral load, like there's a lot of virus on it. So like that means somebody's sitting at like post office and like, and but then we're now screening people at most of these institutions with temperature, make sure they're healthy. They're wearing gloves. We had the anthrax scare, like, I don't know, 15, 20 years ago. So now they're a lot more cautious about what they're putting in the mailboxes. So.
And then, of course, there's a transit time too, which helps to, decrease the risk because it has to come through mail at least 1 or 2 days, So I think at
weekends.
So that kind of helps too. I mean, but it is. I think the risk is low from a letter. Mm-hmm. Yeah.
If questions pop up on the Instagram live feed, are you going to tell us?
We got IG live here. J Nads is here.
Question: are we taking any examples from Hong Kong or South Korea in reacting to this pandemic?
Yeah, I mean, we should be. So, I mean, you said Hong Kong and South Korea. Yeah. So, I mean, Hong Kong and South Korea have shown less issues with this than others. And they had, it's a different healthcare system. They were able to screen in South Korea everyone. And that's where we got that data about young people being vectors.
Right. Uh-huh.
And they shut things down quicker. They had mobile testing. They mobilized things a lot quicker. People took it more seriously earlier. But we can't go back in the time, but we are in a situation where we're, I think, ahead of Italy in that, there's an article published yesterday by some Italian doctors in Lombardy, which is like the epicenter. They said that their hospital, which has 1,000 beds, which is twice the size of Queen's Punch Bowl, when they got up to 500 like patients who had COVID-19 confirmed, which were nowhere there.
Right.
They were trying to speak out, and their leaders, the politicians, were like, "Oh, don't," and they were being kind of shushed. And so luckily we're not there. We're moving fast. The numbers that you see online, that's as much as we know.
Right.
I mean, tests are coming back quicker. We've had to revamp some of the systems.
Yeah.
We don't have as much as we want.
Yeah, our testing. I think one thing we could have learned in hindsight or could have done differently is like how in South Korea how they can test 10,000 people a day. In the U.S. we can't anywhere test that many per day. And it was there was
we could if we mobilize like the private industry.
That would be something.
Like, I mean, you're going to run out of reagents and stuff like that. So it's
look at Oahu. Like what would be a realistic number of people that we could test a day here?
Currently,
it's not as good, or what's the current state of this whole thing of testing?
Well, I mean,
currently we're able to test people. The issue that we have here is that the 2 local private labs that are able to do testing. So now you can't just get a test and start doing it and giving the results right away. You have to like do what they call validate. So they have to make sure that their machine, their reagents match like a known to make sure that it works correctly. So right now they're in the validation stage. So if you go and get a test, they'll swab your nose. They'll send it to one of those 2 labs. They'll take some specimen and they'll run it on their machine, and then they'll send the other specimen and they'll send it to the mainland to run on the mainland to an already validated lab. So as that process happens, once they get their number of patients that they need to have to make sure that they can validate their system here, then we can do it locally. But as of right now, we're sending out most of the specimens, not all, but most of the specimens to the mainland. So it takes about 3 to 5 days for the results to come back. If you're really like high risk here, then we can do it on island. From what I'm told, we can do it on island here. So that can be a much quicker turnarevaluation time. But because the reagents, same day, right? Same day.
Oh, you could do same day.
Like 4 hours, yeah.
Because we got, they revamped it.
Yeah, so it's getting better. Every day it gets better and better.
Okay.
But it's it's a process that we're trying to go through.
But we could have missed a lot of cases of people coming in with coughs and fevers, and everyone's frustrated. They went to the urgent cares. They're standing in line.
Yeah,
right.
I mean, I was equally frustrated. I was more frustrated. I was in the hospital trying to work, trying to get tests, and so it's been difficult for everybody. And when I ordered a test, when a clinician wants it, no one's holding you back.
Yeah,
but it takes a little bit of confidence to initiate like this huge protocol,
right?
Where you start utilizing all the masks and N95s. All of a sudden, you're like utilizing resources. So it's like this weird dilemma you're in, where it's like, okay, well, I think this guy has it. They got this for the diagnostic features, but there could be this that could be causing it. But for me, it's like order the test.
Yeah.
But I mean, I'm not wasting a bunch of resources. I didn't order a bunch of tests, but like we do need to be conscious. We need to be proactive at restocking the masks and gloves, which we are hopefully working towards. Yeah. Josh Green's talking about it this morning.
Right. So let's clarify that for the people that are still walking around. I know, Pachi, you're ready to punch these guys out. But the people wearing masks, who should be wearing face masks for the record?
If you're sick and you're outside and you're going to snot cough on somebody, well, first of all, don't go outside, have somebody do something for you.
Yeah.
Well, there.
Yeah. You stay home. But I think it's primarily for people who are sick and who would be at risk of transmitting, right?
Yeah. And then, the problem is that we are running low. We haven't run out. People need them.
Yeah.
We're not, we're concerned with
locally, we're not yet, but we're getting low.
We're getting low. And then there's also ambiguity in like the protocols, like who gets a mask, who gets it to be an airborne N95 versus the other one. And, and that's changing. WHO had one recommendation mid last week, but it didn't get adopted by CDC. So it's like frightening for medical staff to be out there wondering if we're covered or not.
It changes day to day, hour to hour sometimes what you're supposed to be doing, and it's because nobody knows for sure. I mean, we're learning as we go.
Right. But if we think somebody is suspected, then obviously it's instigated to wear that. But so looking at people who have died from the disease, the 76-year-old physician in Italy who died a few days ago, they ran out of gear and he kept on treating patients. He kept on going. He said it was his duty to do it. And the 40-year-old in Seattle who's a critical condition, different healthcare workers who have been harmed by this. There's no actual data yet, but it's thought to be a viral load, like the amount of virus exposure. So people who are, intubating, putting in the breathing machine, breathing tube, they're right on top of somebody, right up in their grill.
Yeah.
So if they,
right over their mouth.
And like that's one of the highest risk things. That's why the Anesthesia Society, and that's why stopping these elective procedures and remobilizing teams and so in the hospitals now, and like locally too, but around the country too, they're stopping all the like surgeries that are optional. Like if you don't need your boob job this week, you don't need your, if you can wait for your ankle to get fixed, you can wait a little while, Yeah. So because like you said, the getting blood over someone's face is risky, and you playing with their mouth and stuff. You can aerosolize the virus into your face, and if they have it and you get it right into your face, you get so much more viral particles. That's a much higher risk of catching it that way than if you were to like be walking by someone on the street, And one of the issues is that, let's say the person who's doing that procedure, obviously we're all putting ourselves at risk, but conscientiously, like, so what if the specialist gets ill? So they get a fever, and they got symptoms, they go home. And we don't often have a really robust, like long list of specialists sitting around waiting to get activated and come in. I mean, we're in this critical shortage going on. So and we experienced that firsthand this last week. And so
a couple of specialists we lost.
Yeah, so, but then, it's like getting pulled out of the ring and then you're standing on the sideline from home and you're just like waiting to go back and you're waiting for the test. And like, we can mobilize backups, but like, it's not like we got a huge list of people. So like, we got to keep people healthy, even if they recover well and or if they don't have the virus, we can't have them in there doing procedures on people and then transmitting even more and then causing more critical illnesses.
Well, speaking of healthy people, any healthy people out there on IG Live? Any new questions?
Oh yeah, it's probably more. How many questions have you gotten so far?
What's going on?
We got 2 more. Number of cases are naturally going to go up when test kits are available.
Yeah. No.
Yeah.
I mean, we're trying, but it's a national issue. Like everybody wants to test. Mass testing is exactly what we need, but like, unfortunately, we're having to triage. At least we're not triaging ventilators like they are in Italy, where triage meaning you have to pick the sickest person and then give it.
Them,
And so that's the triaging of the actual breathing machines. Like they're not, you're over this age, it's it. So we're not there
say I
yet,
want to get tested. Say like I'm saying, I wake up and be like, hey, I don't feel right.
Like the whole NBA team that got tested. And
exactly. See, that's the testing people now. If I wanted to go down to a testing center, what do I do? Am I able to? Should I be able to? It's the process itself.
I mean, first of all, if you're really sick, then get help. You need to seek out healthcare facilities if you need help. So and call your urgent care. I mean, everybody should have a PCP, but I mean, unfortunately, for some reason, the last 10 years, like no one has a PCP anymore.
Right.
And so, but if you did, they're actually mobilizing more resources for the health insurance companies to just allow you to do more digital stuff, like just call and they can prescribe stuff for you. But if you're ill and you want to test, it's not really like you want a test. You would need a test, like we're unfortunately in this position where, we have to give the test to those who are the sickest because let's say we bring somebody into the hospital and then they're really ill and they look like they're sick. Then that person definitely is positive. We have to test the people who are right there, who are getting more ill right in front of us to know what's going on. And then the chain link from there. And so that's like a absolute priority because if you're a little bit of fever and feeling okay and you can stay home, then that test can go to somebody else. But don't just sit home and if you're getting ill, like reach out for help because otherwise you'll get more sick and then you'll end up in the hospital. And like we want to be efficient with our healthcare and keep people healthy. Right. So don't just hide.
Right. What is of the three famous or more questions?
One of the questions is what's the operating procedures for anyone walking in to the medical facility
I don't work in the urgent care. I don't know. I work in the hospital. Like, so I'm like, ER hospital, big.
In the hospitals now, they have, you go to like, if you have like flu-like symptoms, you go to the ER and they usually have someone outside, a team outside to check you in. So if you have symptoms suggestive of flu or some kind of respiratory thing that could include COVID-19, then for right now, you're sent to a separate area. And there, you kind of worked up there.
The tents.
The tents, yeah. So you see outside Queens Punchbowl. I think M.P.H might be doing it now, that they have tents outside where you're separated from the rest of the ER. And then you're evaluated there. And then they give you the test, your temperature, do blood work, swab your nose and stuff. Do that outside. Keep you away from the regular ER because people are still coming to ER with other things non-COVID related, right? So we want to keep you away from the sick people too. But we have sort of a special area for them. I think in urgent cares, what they're recommending, what I read most recently was to call one of the COVID hotlines. Mm-hmm. So Queens has a COVID hotline, for instance, and I forget the number. I wish I had it on me.
I posted it. I'll have you post it on your story.
Yeah, so there's a COVID hotline. You can call them and talk to them, and it's staffed by nurses, and they will talk you through your symptoms or talk you through, like, did you go anywhere? Do you have a fever? And then they'll direct you to where to go. Like, go to a certain urgent care, go to the ER, they'll direct you where to go. And that kind of helps. If you just show up and you're like sick at some place that's not set up for you, the risk that you could infect everybody else there. So it's best to call, I think, beforehand.
Gotcha.
But if you're sick, you're sick.
Yeah.
I mean, if you come in, you have breathing
Don't be afraid
problems,
to go.
You need to be put on a breathing mask or whatever.
Yeah.
Like, that's going to happen regardless of just the normal protocols. But the issue is if you ran out of your inhalers, or you think you're going to run out, like, call now and get them refilled. Or like you.
That's something I should bring on too. Being on the pharmacy side, so we are facing a national shortage of breathing medicines right now. So the inhalers, asthmatics have inhalers. They are running out across the country. It's becoming harder.
Is it nebulizers or MDIs?
These MDIs. So the actual inhaler itself. So if you have asthma, you have two choices. You can either have the inhaler, like you see the puff, or they have a machine that you can put the medicine in and it'll nebulize it and you breathe in, like, it looks like steam you're breathing in. That's it too. So the one with the steam looking one, the nebulizers, the supply is okay right now. It's starting to go down. But the inhalers, the MDIs, we're running out because if you're a suspected COVID patient, we can't have you use the nebulized medicine because as you blow out, you're going to be blowing the particles around, like the ER, for instance, right? So you have to use the inhaler because you blow the medicine into your mouth, right? But then that inhaler becomes now infectious or possibly infectious because in your mouth. So when you leave the hospital, we have to throw the inhaler away because it's infectious.
Which is a stupid process.
Which is crazy, yeah. But unfortunately, around the country, so the whole entire world is needs to get those inhalers. So if you're asthmatic or or you use one regularly or even not regularly and you're running low, refill those now just to have. But it's good for like 2 or 3 years, after you get it. Usually, it's check the date. But if you're someone needs that and you're running low, refill them now.
Yeah,
because we might be out soon.
Wow.
Just to clarify, the reason we have to throw them away is because it's a licensing thing. It's like a safety protocol. We can't just let people take medicines home with them from any hospital. Okay. It's just it seems intuitive that you could just walk away with it, but it's like it's not set up that way. It's a different prescription system when somebody leaves a hospital, and so it's like a safety concern, and so that's a national thing.
Yeah.
Speaking of things that have been running out, question here from a listener asking about the hand sanitizer. Do hand sanitizers, all of them, work? Is there a certain brand better than the other? Is there a brand to avoid? How can you tell that all of these hand sanitizers are legit?
Yeah, I mean, I haven't reviewed the data on that.
So. They're not. I think for the most part, I think a lot of them are good. But I mean, the ones that come from like medical companies, type of ones, I would say probably are okay. I haven't checked for sure myself, but I would maybe question the other brands that are more like colorful and scented and stuff. You know.
I mean, just wash your hands with soap.
Yeah, wash your hands with soap and water.
That's the bottom line.
You go to a thing and you're dumping out of this communal Purell. That's a plastic bottle right there that you're pushing the top on, and it's more plastic waste. And so, soap suds are really effective in getting into and you wash it and it kind of. I think my fiance is reviewing a lot of data as well. So the lipophilic nature of soap and how it kind of can get into and under things. It's way more simple to just trying to wash your hands with soap and water.
I'm sure glitter does not kill viruses.
Yeah.
The stuff it's in might kill it, but the glitter, I don't know.
It might.
And the plastic beads that end up in the ocean,
Yeah, what about those beads?
Yeah, the microplastics.
So just wash your hands with soap.
Soap and water is the best, though.
Soap and water always.
Don't forget 20 seconds, sing whatever song of your choice.
Pachi, give us a house song right now. House song no? Okay.
There'll be 20 boring seconds of...
Okay. So, I got another one. How much damage long-term will there be from this if someone were to get it, someone comes out of it? Any long-term effects?
We don't know yet.
Yeah.
But, I mean, we can look at China. We can look at the other data from other people. The reoccurrence rate, like if you have it and you get it again, that's being looked at. We don't have a lot of cases of that are known yet.
Because with many virus infections, viral infections too, if you get it once, you usually kind of don't get it again sometimes, but not all of them.
Because you create antibodies.
Yeah.
Which is like the next phase of testing to understand.
But this one, there seems to be a low number, but you maybe could get infected again with the same one. But we aren't sure.
We're looking into it. Yeah. So antibody testing is the next phase, and that's trending today on the data. And we can learn from hepatitis B, hepatitis C. And if you've ever had to run one of those panels, there's the surface protein, the core protein. There's different components that will actually tell you whether or not you've just been exposed to it, or you had the vaccine, or if you're infectious. And they all peak at different times. And this takes a little time to figure out.
Right.
You were raising your hand. You said.
Any more questions, Jay?
About zinc being used inside the cells to prevent the virus from reproducing. Any knowledge?
Oh, zinc like a supplement.
So I mean, we talk about in actual wound healing, we have we use zinc, on wounds. I can't comment on the microbiology data right now because I haven't. And that's what I think I want to emphasize is don't say something unless you know and you've read it and you know your source because that we're in a confusing state.
Right.
It's interesting to watch physicians and medicals, everybody specialists have to on the fly learn. I mean, the hydroxychloroquine, azithromycin studies that got released from France this morning. I combed through it this morning. Luckily, I'm off work right now, waiting to get called in, as a backup system. But that was published today, and they're pushing things through peer review quickly. The ibuprofen thing. It's just for me as a medical professional. If I have a fever, you just use Tylenol. I've always just used Tylenol. I don't use ibuprofen because there's other side effects of ibuprofen, naproxen that is already well known, like stomach bleeds and other things like that. And so are you going to die if you use ibuprofen or use it? No, I don't think that that's what the purpose is. It's just like, try to use Tylenol. That's what we already know for fevers.
Right.
Yeah, the zinc thing too. I mean, we don't know the answer to that right now, and we probably won't know the answer to that because even zinc lozenges, as far as like preventative medicine, people will talk about that, but it's hard because there's not studies that are robust enough for us to answer that question.
If
for
somebody's
sure.
sick and worried about it, like that's different than like you need to seek medical attention.
Right.
But at this point, like empiric treatments, unless you're ill, we need to work on the spread. That's more like the amount of effort that could go into trying like comb through some of that literature versus like just trying to like retweet, repost, the fact that we need to be conscientious of the spread is going to do way more of an impact than some of the these details. I mean, maybe tomorrow Zinc's going to come out as like the most revolutionary thing and I'll look like an idiot.
You mentioned elderberry to me yesterday. I was like, wow, okay, let's get echinacea on board and let's bring it all in.
I don't know.
Because right now, as far as definitive treatments, if you're infected with it, we don't have any.
Yeah.
None that we have things that we think.
Well, I don't know. The study is just more hydroxychloroquine and
Yeah.
azithromycin seems pretty effective.
So we have things that are coming out. We have good, like strong candidates.
Yeah.
But as far as like an official list, we're not really clear yet.
Mhm.
But what we do know that works well is trying to prevent the spread of it.
Yeah.
Right? We know that will definitely work to help to flatten the curve, as they say. Right?
Yeah.
Right.
And there's details in the way that information was presented this morning. I know that President Trump kind of did a big little press conference talking about these early findings, and that was really important. I think the thing that we need to be careful of, the words that were used were, you can get it, you just need a prescription, just go get it if you need it. So you got to be careful there. You need to talk to your provider. You need to talk to somebody who's a medical professional to get it.
Right.
You really shouldn't be telling your doctor what to do.
Right.
If that's the case, you got to get a better doctor who's actually educated and able to help you. I'm just kidding. But like we've seen resistance in malaria to chloroquines. I mean, I don't know. I've been offline for a couple hours now for the responses. So we have to be careful. Those resistance patterns to chloroquines drugs as a group are actually regionally based. So you look at the medicines you use for somebody who travels, like, one person goes to, Mexico, Central America, or Middle East, it's a different type of malarial treatment. And they're still chloroquine sensitive, which means it works. But other places, they're chloroquine resistant. I don't know if there's a correlation between this virus and us developing that. There's also an adverse effects with hydroxychloroquine, QTC prolongation, which is like the heart arrhythmia.
There's a lot of, there's side effects from it. So like he said today, like, just go and get it. We've known this drug for a long time. It's easy to take.
Which is true. We do know for a long time.
We do it. Yeah, it is an older drug, but there are side effects that go with it. So it's not like just take it and there's no risk for anything else. Certain people might have risk from it, but also the dosing, I think that they're announcing now that they're saying that they might use for this viral infection is not a dose that it comes in usually. Yeah. Right. So I think that the dose that they studied was a lower dose than it actually comes in. So that may be an issue. So they might have to have the drug companies reformulate it into a different dose.
Which people are all hands on deck.
Yeah.
To come out. But this is for like providers, like who are in the hospital struggling in Italy. I mean, this is being reposted like around the world. People are, posting it at Stanford because they're trying to get like early access to whatever they can do for people who are just going downhill, Not so much. I don't know yet for the person who's just sitting at home with a fever or the cough and they're getting a little better.
Much hunker down until you feel, and then you call
theoretically, but if you're getting it more ill, seek help.
Right.
So,
little offshoot: woman who's pregnant during this whole situation.
Yeah.
Does that put them at higher risk? What is precautions, or what would they need to,
like if they're infected? I mean, we got cases in New York where they have to figure out how to do C-sections on infected women. That was yesterday. A few cases. Right. Is somebody who's infected,
just someone who is just
or their exposure
mother, just worried about the whole situation. Is there anything that they need to do extra than the average person?
Social distance.
Social distancing again. We haven't said that in a while.
It's not just like the distancing. It's also like the consciousness of like the what you're touching and all those things.
Right.
I mean, there's a lot of ways. My fiance slept in a different room for a few days, which really hurt my feelings when I was working. but it was, I think she's worried about, exposure, transitions, risks and stuff. And,
because we don't know yet. I mean, how, if you're to get infected when you're pregnant, any kind of, if there is an effect on the pregnancy or not, and what you're talking about there is like, okay, they're infected, they're pregnant, and then they have to give birth. And that, of course, is a very close contact thing when people work there. So how do you do that successfully without spreading around? But also at the same time, different. Like, is there a problem if the mother's infected with the virus? we don't know yet. I don't
but
think
people do know right now. So there are cases in New York of this exact situation. And we already have these physician groups of like 250,000 people private, on Facebook, random things like that, where we are sharing this information with each other in a private manner. Like it's not, there's no patient health information, identifiable stuff, but we are working through this. And that is the best coordination I've ever seen in my life. I mean, I'm not in medicine for that long, but I mean, social media isn't that long. And I'm not trying to do shout out Facebook or anything, but like,
right.
don't, by any means, I'm not. I'm not. So, but we are having to work together, and we are working through this. It may seem like we don't know, but we really are doing a really good job, like using our the furthest knowledge that we know, the best practices, the best data, and questioning each other. People who misquote data in the medical profession is becoming less and less. I think last week people were just throwing things out there, and it's like, okay, no, do not say something if you don't know. You're gonna like make somebody else think something else. And so it's like, just look at the data, look at what's out there, and it's hard. It's really hard. I mean, if you comb through some of those things that posted on Facebook, it's kind of got a lot of. It's not meant for just leisure reading after a couple of beers or anything.
So. And this is such a new, this is like unprecedented sort of situation that we're in now.
This is so new,
very new, and so most of the things that we treat, even the newer things that we come up, it moves at a much slower pace. So there's time to like do research, build knowledge bases and stuff, and like peer review. But this, because it's moving so fast, I think to the credit of the medical field is that, like in that Facebook group, is that people are able to now discuss things quicker than that normal process takes. And
it goes out to the public. I don't see things in there that aren't being disseminated widely, so don't worry about missing out. It's just annoying if I've seen people get in there and ask questions that aren't like the MDDO level, and you're like, wait, what is this post? So it's it's distracting if we start putting people in there who aren't asking with the data driven. So that's why they kind of restricted that. But to get out of the weeds of like the way we're dealing with this, I think we should focus on positives. Like, we are not running out of ventilators here right now in Italy. We can really stop this by adhering to the recommendations by the medical professionals, and we could technically get people back to work sooner. The faster we can do it, we can maybe even look better than the rest of the world if we're able to show that maybe there's less coronavirus here, which could be really positive message, and it could boost our economy. I might have said that earlier, like after this is done, which would be incredible for everyone. There are stimuluses coming out for people making less than $75,000. So there's there are things in the queue, but.
So as you're bringing this up, if we look at what would be as a best case scenario situation where we all hunker down for 15 days, what have you, we're all everything's closed. Will that be after day by day we see just no more cases that will lead to us all? So it's based on
it's what we call the incubation time. So let's say that you have cases coming up positive. Okay. It's thought to go away in maybe 5, 7, 14 days, that you still have a viral load that's detectable. So as soon as people stop transmitting it to each other, that is day one. So the fact that people stopped in Seattle on their 14-day quarantine, but we're not, we're messing up their attempts, to be honest. People are doing quarantines everywhere else, and if we're not, then they need to go longer. Because until we get everybody not transmitting it, it's like, you're just reintroducing viruses when they fly back. And so it'll be at a lower level, so it's not like it's pointless, but the faster we all do it together. I think last night was quoted by the NIH, maybe by the 30th or first week of April, we'll have a better sense of the numbers, where they plateau, where they level off. Once we start seeing that, then we'll have a better sense of what's going on. It doesn't, it seems really depressing right now that everyone's just sitting at home, but
a little bit.
We're working through it.
Yeah. So. Right. Because I'm just thinking, if we just fast forward to, say we go to, let's say this is the first week of April. Let's see, the cases are in the single digits, what have you. That might be a case now. I'm just going to keep referring to the phone and just come up with something. If April comes, first week April, we see cases 1, 2, what have you. Is that low enough to be okay, everyone, we can start coming out again. Let's start opening things. How is that process going to be like? Are we just all open, a mass opening? Every bar opens today. How will this transition?
Not sure.
I think. Well, this is going to come from a national level of experts.
Yeah.
And they're on it. They're watching closely. I mean, we've never had something like this because we've never had so much sharing of information, which is like to our benefit.
Right.
We've never had the ability to like live upstream all this data, like, and have these like free New York Times that's like popping up all this stuff, and people with registries that are electronic for what's going on, and communications like this, mobilizing powers. So we've never really had a situation like this, which could be to our benefit, hopefully.
Yeah.
And so I think, when I diagnose, it's akin to like, for me, when I tell somebody they have cancer, like if I find a new cancer, I find some mass somewhere and they're in the hospital and they don't know, and I have to go tell them like, hey, this thing came up, and the family's there, and they just don't know how bad it is. They don't know if it's metastatic. They don't know if they're going to die from it. They don't know a lot, and that fear of the unknown is really a phase that it really sucks. It's terrible.
Yeah.
But
Exactly.
the more we know soon, the better we can find ways to move forward.
Right. And that's basically what we're doing here right now, is just trying to eliminate some of the unknown.
Mm-hmm. And with those cancers, like treat them potentially, like, but in the phase when you don't know, this is very anxiety provoking because this is that phase,
Exactly.
I mean, but it's not going to be forever. We're going to find this out soon. And everyone just has to hang tight.
Right.
Yeah.
And do their part, which they are.
Right.
Yeah.
And that's what's caused a lot of this. And that's what's caused this fear of the unknown, caused anxiety. And anxiety leads to therapeutic toilet paper buying. And then that leads to all that shit.
Yeah.
And it's this thing. So people feel like they need to do something. Well, as we get into the summer, I know a lot of people are thinking of this one. The heat, is this still a new thing to even discuss? Is heat going to kill this thing off? Is summertime going to kill this thing off?
I mean, I have a comment on that. So, we don't know yet, but what I think the thing that was really cool is that this morning there's a live interview with JAMA, the Journal of American Medical Association, with one of the higher ups of the whole entire Kaiser Healthcare Foundation in Oakland, and they were talking about, because we draw parallels with the flu often.
Right.
And the flu numbers this week in the Kaiser system are going down from last week. So that's the idea behind flu transmissions, and most of the viral transmissions which are contagious like this of a respiratory form, just different from viral transmissions like HIV and hepatitis, which can be more of like a bloodborne, which is different. And some crossover obviously. But I'm hopeful. Yeah. And so we have to stay hopeful. We just don't know yet, but luckily flu numbers are going down.
Yeah.
And so hopefully this can plateau down. Maybe we're just diagnosing all the cases from last week. I don't know, because people are getting more sick. People are getting really sick in New York and Washington. Yeah. And so we got to stop that from happening here. Like, it is devastating what's going on over there. Yeah. And so the amount of deaths happening, the amount of people running out of machines, chaos. We don't have that in Hawaii yet. So we have to be proactive.
Yeah.
And that's why I'm sitting here right now. I'm supposed to be off. I was supposed to go play golf and like enjoy my life. I worked 100 hours in 7 days from last week, and like staying up late researching, reading. First thing I did this morning. Yeah, no.
We gotta start drinking now.
I know, right? But it's like, the reason is because I think this is important. This is like this is the window right now. This is the window
exactly
to act quickly, work together, support each other, call your loved ones, see if they need help with picking up medicines. Don't if you're at home, other people are home too. FaceTime them. We got Wi-Fi now. It's crazy. You can just get on a video screen with somebody all day long as much as you want. It costs nothing. Yeah. So check in with people and make sure they're okay, and if you can help them, and we'll get through this together. Everyone's freaked out. We're all in this together.
Yeah.
So
that's really the main thing when it comes down to. Anything else that you wanted to add before we get to any more questions? Well, actually, let's go to the questions now. Anything IG Live? What are they saying?
We're going to address other ones later too. We can try and make sure. I want to make sure people's questions are addressed so we can get the list down.
Sure. Yeah.
So,
numbers like recovered patients. What's the numbers like for that?
I don't have that data. You go to New York Times. They have the live updates there. That's a pretty comprehensive. Recovered is hard. Because we also have people who are sitting at home where they didn't get the test, and maybe they recovered, and so we don't know yet. Not everyone dies from this, as we know. So, yeah.
So with all the cases that have come out, and I talked to Pachi about this before we started, they are all saying that they are travel-related cases here. Do you believe that?
So I have my own. So what is travel related? What are the guidelines for this? CDC has guidelines on what you. I was just informed actually a few hours ago that we revoked the community transmission category of the young lady who was working.
Cool Orange.
Yeah. So, which I don't want to get in trouble. This is going to be online forever. But I feel like we need to have a lower threshold for what we use as a way to get us to act quicker. So once you prove a community transmission, you can then mobilize more national guidelines to test more people.
Right.
You can't test a cough and fever unless you have community transmission. You have to do this other, more restrict guidelines.
Right.
And maybe, so community transmission by the definition on the CDC website, which I had to go back and write down and make sure I reread, because I kind of disagreed with that reversion, but I'm not the expert. I'm not saying it was community spread from the CDC. Community spread means people have been infected with the virus in an area. So versus they got it in a different area and they brought it over.
Right.
So, and that's a confusing thing too. 14 days, quote 14 days. So somebody's here for 2 weeks and get a fever on the last day and they pop on a flight to Oregon and they test positive. That's actually, no, that's not, that's like a traveler. But like, that doesn't make any sense. So, I mean, there's all these semantics. I think we should get over that and just start testing more people, and bring the guideline down. Like, just that many cases. I mean, I had to wait days on some of my cases, but like everyone's having to wait, and all, minor negative, don't worry. So like, but like, and not just me, I'm not trying to release PHI, but like, we are, working quickly in the entire state hospital system. And so, to get these tests back, and that's more important. And the community spread, I think there's more community spread than we're reporting.
I
don't have the data.
Yeah,
I think there's more community spread than we
it's
know
annoying,
of, because we can't. We're not testing for everybody that we.
But everybody's annoyed. No one.
Yeah.
The whole United States is annoyed. So.
And then like how it's defined too, because like he had said how they defined it, but in a hypothetical case, let's say this person is working in Waikiki somewhere and they're at work and they haven't traveled out of the state for 10 years. They've been there and they're at work and they come across a tourist and they catch it from the tourist, and then that person is now positive. They're positive here. I think by definition, they're trying to say that that's not a community spread.
Oh, that's what came out today. That's what they're saying.
I think that's what they're saying, that that's not community spread.
So they must have everybody in that 25-person household stay home and not get a test.
So right,
Yeah.
Sorry.
Is that exactly?
That's what, to me, I'm like, but if you're in a community, like if you're at work and you didn't travel anywhere and you got that close,
didn't they test them? I think they tested the 25 in their house. So,
yeah, maybe. Yeah. But I mean, I feel like if you haven't gone anywhere and you're at work here and you catch it from someone at work, no matter who the person is, whether they traveled or not,
Right.
Yeah.
to me, that's, you caught it in the community, therefore that's community.
Right.
I mean, but of course, there's very specific ways that they define that.
Which could be true. Hopefully that's good. Hopefully we don't have community spread. I mean, that would be awesome.
Of course.
Right.
So, because I think they are, anybody who tests positive, they are being very proactive, the Department of Health.
Right,
Getting
yeah.
hold of everybody, testing people. So like,
Right.
I don't mean to make a joke about that. Like they are being very
Yeah,
proactive
right.
about this. So-
Yeah.
Of course.
But the semantics of how you define it, I think we got to be just thinking about like
Yeah.
moving upstream from this.
Yeah.
Like,
Right.
how do we stop this? How do we stay healthy?
And as far as people traveling and returning to the island, is this, as of right now, this moment, there's people ready to screen you, or are you going automatically to a 2-week quarantine?
People who are watching the news instead of watching us right now will know more.
I would
Yeah.
think is this
It's
something
changing right now.
It
So-
changed
right?
today a couple times. Yeah, I'm not even quite sure. I know they're trying to add on that, like all people returning 14-day self-quarantine, and then they're doing temperature at the airport, but I'm not sure where we're in that process yet. But I mean, that's what they're talking about.
The cruise ships, that and the cruise
They
ship.
changed that
situation,
cruise
that's
ship
changed.
one though. They changed it. Yeah.
Okay.
Right. It's no longer docking, letting people off. It's just going to be.
Okay.
You're stuck on a cruise ship for like.
So much buffet you can do.
But
I just was wondering, as far as that seems to be the next that needs to be cut in, as far as not shutting the border down, shutting the gate. Maybe that needs to be done at this point. Maybe it's too late. I don't know. But if testing goes on as they get off the plane, is that a major one as far as just helping to prevent the spread?
Absolutely.
Or-
I mean, we're on an island here.
Right.
Yeah.
We're on an island, and
Is
the
that
rest of
the
the world's
main-
infected. Look at New Zealand. Look at Australia. Look
Yeah.
what everyone else is doing. They're not
Right.
letting you come over.
Yeah.
So
Because of the fact of
So
it's
it's-
not community.
right, is all the cases are due to travel.
All these
not-
traveling
not-
guys.
Yeah.
Right. So if we just
regardless
shut that
community
down,
or not, like
Yeah.
it
Okay.
needs to happen. I mean,
Yeah.
our famous actor came over and he's doing a good job of trying to make sure
he
he's not
did
affecting
exactly what
people,
you're supposed
but,
to do. Yeah.
other
Right.
people too. You just got to be careful, In fact, it's not just the people coming in. We're all supposed to be doing it. We're all supposed to be in a pseudo self quarantine. That's what social distancing is.
Right.
And so, so it's as long as we're practicing that, I think the emphasis on that was everybody if you come over on a vacation, we're not gonna have the zip line set not the luau's.
Yeah, the activities.
We're not going to take you out around the town.
Because we have to worry about.
It sucks for people who are working in those industries.
Yeah.
You
Right.
know?
But I think as far as travel goes, I mean, it's going to affect people traveling here because if we don't ban it all out, if they still come here, there is going to be not much for them to do. Like how this morning they're at the beach on the news, and she was like, there are so many people here at the beach, and she's like, people are not listening to what the governor said.
Right.
Although he did say it in very kind of soft terms. He's kind of like, you should maybe think about not doing that.
Let's go on to Mr. Passive
Well,
Aggressive.
just to timestamp this in case people watch this on YouTube later. This is 7 p.m. on March 19th, Thursday.
Yeah.
So if information comes out after this as different and we look
happening
like
now.
idiots, this is timestamped. And
Sorry,
so
old.
this started around
Could be,
6
could be.
p.m. on Thursday the 19th. So
Yeah.
Gotcha. And do we even need to bring up our beloved governor at all at this point?
he's responding to the concerns now. I think
She'd been more firmer though, rather like how Chris
I
is
don't
saying.
know.
Like we should.
It's a
ask
tough thing.
them.
It's a tough thing. They're putting people out of work. It's a really tough.
Yeah,
tough.
There is that factor.
But people are hearing about it. I was talking to somebody this morning in LA, and he was like, "Oh, I can't believe that the governor is actually going to shut it down. That's such a bold move when your entire majority of people rely on tourism. Like that's such a big move." And then he's like, "But it's necessary. I mean, they're on complete shutdown over there."
Right.
So
almost like Hawaii is right now, where he came out and said Kauai's on vacation. Is that the ballsy kind of move that we?
not fully. It's just 10 p.m. to 5 a.m. Right?
Was that it?
Yeah, that's the
not-
the curfew is 9 to 5 or 10 to 5 at night.
I don't know if it's a whole day.
The day I think you can, but I think he still closed most of the.
But he's being proactive. very proactive.
Most of the things that. Stuff like that too, right? So I think you go to certain activities there.
Yeah, which is great
But-
to
I mean,
disencourage. But
anything
you could
that
still pick
helps.
up an animal from the shelter,
right?
because that's have you been to the Kauai?
Oh,
They get the animal shelter.
really?
There's
You can still get animals.
running
Yeah.
free. That's really cool. So you could do that now too.
Well then.
So things.
One,
Okay, so
check
things
that off.
things to do while you're social distancing.
Right.
Yeah.
Right.
Go shout out Ed Kenny and these guys. Pick up some food.
Shout out Ed
Local
Kenny Town.
food, putting people back
Kaimiki
to
Super
work.
Ed.
Yeah.
Mud and water.
Red water's going to be
Mud and
empty.
water, yeah.
But,
It's a crazy situation. IG Live. What's happening with the IG Live? Everybody's
I think their sleepy time has hit effect.
Is
They're
sleep
probably
time now?
yeah.
At this point?
Are you
They're all
trending the
running out?
numbers? They're probably at 1 or 2 people.
Right. They're checking out.
So
There you go. They're all on Twitch right now streaming video games.
they're over it.
Well, I got both of you guys. I have to say, just thank you very much for joining us because I know you guys are busy.
I mean, I know you're busy. I mean, none of us
Yeah.
are getting paid to do this. We all just care about it.
Right.
So
Yeah.
And that's the main thing of this whole situation. Just inform people. Just try to alleviate some of the stress of this whole thing. That's all we can do. New situation, like you said. Stay home. Go on Twitch.
what's Twitch?
Good answer. That is a great answer.
Oh,
It's this thing the nerds do. It's fine.
Oh, okay.
They're streaming video games and probably who knows what they're watching.
Oh, okay.
They're
Oh,
watching
is that what when people stream video games?
stream
at it?
probably right.
Oh.
It's probably porn at this point.
Oh.
But that's not here nor there. Main thing you should do it at home. Main thing you should do it social distance.
Especially if it's porn, you do it at home.
I hope so. And please support. Let's emphasize again. Let's support these local businesses that are still trying to. I'm out of work. Okay, I'm in the fitness industry. I'm out of work. All right.
Yeah.
You can't go to a gym right now. All right. And I'm not alone with any other type of employment. So all these people that are trying to stay alive, really, business-wise, Ed Kenny, Mud Hen Water, Town, Kaimiki Super Red, they're doing takeout tonight. Please just keep supporting these guys. That's all really we can say at this point, and just
and listen to Josh Green now because he's speaking up.
Yeah, he's really going the right direction.
I don't know if all the things he said are going into effect, but they need to, like, literally need to.
That's the thing that I'm worried about there, because he's now he's doing the ballsy moves. He's coming out with that list, which
it's
is
not
great.
ballsy. That's what we've been asking for weeks.
He's finally coming
weeks
out,
and months.
right?
And
Think, will someone listen to this guy finally?
Yeah,
Implement this.
Like the thing I'm going to get on tonight, on work on tonight is the access to the masks. So we have chains of connections in different around the world of people who are maybe we can get the masks from and the protective gear, and we have people locally. I mean, I'm looking at text right now, people who philanthropist groups that can maybe mobilize funding, and then we just got to work with the Department of Health to figure out what our backstock is, and then get ahead of it. And so, that was in one of Josh Green's things is like mobilizing that effort. There's a lot of different things and coming out soon, hopefully.
And if you are not a medical professional working in a medical place and you have masks that you hoarded, however you got them, if you use them, just use them correctly. I was at a supermarket, not the one today, but a couple of days ago, where all of the staff was wearing masks and gloves. Not one of them had it on correctly. So they don't work unless you use them correctly.
Can we display?
Yeah. Yeah, when you can show you.
This one's clean.
You got one?
Yeah. It's clean. I had it because I'm coming out here, and if you guys got me too close or anybody's coughing,
I know
because it's
we've
different.
Been infected for years.
I'm working. I mean, if I get sick right now, like that's one less doctor who's going to work in the hospital.
Exactly.
So like,
Trust
this
me,
is a different situation
them,
why I'm carrying it, because if I start getting a fever, like it's going to affect other people because we're short right now. But this isn't the I mean, what were they doing?
So this is the mask that they had, but see over his nose, where inside there's a metal piece that can mold,
correct,
right? So when you get in the box, they're flat, so that it's coming flat. So if you put it on your face, it'll be flat like this. But see the spaces over here? You have to mold it around your nose and around your cheeks, so it makes it as clear of a seal as you can. If you just leave it like that, everything you blow out, you'll just be blowing air out of the side.
Wait a minute, you're telling me that's really what these guys are doing?
That's six of them. Situation. All six of them had it on like that. And wearing gloves probably the whole shift wearing gloves the whole time.
The real thing is don't steal. Like I see
don't steal.
People
steal.
People don't have N95 masks who are physicians and doctors working with actual patients, and they're taking these flimsy ones and they're putting extra tape. They're doing double ones. They're doing double sided.
Trying to
create
our own,
enough filter, and then they're going in and seeing patients because they need to. And so. I'm getting emails personally from my employer that, here's $250 to buy protective gear.
Yeah.
I'm not. I have free money to buy it. I'm not, because we need to use the money together to buy it for the hospital and people who are there.
Right.
So even though I could click a link right now and get $250 worth, I'm not going to do that and mess up the supply chain because I don't need it today or tomorrow.
Right.
Yeah.
And then when I go to the hospital, it should be there. So.
Right. That sums it up.
Sorry, is that like too amped up?
This is good. This is why you're here. This is exactly why you're here. This is exactly it. Not to end on a negative note, like stealing masks.
I thought sleepy time would have like a little bit of whiskey, but I guess they can't have booze right now.
Is that too distanced out?
No booze right now.
I don't know.
Because of this,
well, let's point out
stuff. So
the bright spots that you pointed out several positives of this whole thing. Positives that I've seen. All men washing their hands when they come out of the restroom. I've never seen that before.
Oh, you did good.
I've never seen that. Nobody is peeing and walking out.
I haven't been out in public, and I really just
Yeah,
today and earlier today. I'm not, other than getting food. Like I haven't really been out in public. So.
Yeah, so everybody's clean. Everybody's trying to. They're wiping things. Everybody's wiping down.
Right. Mm-hmm.
Even before my gym closed, people were wiping down. So the awareness is there. I just think that's to keep the awareness going. That's really all this is. This is what this is. And
yeah, people are doing a good job. Like we're not here to give people a hard time. Just trying to answer questions.
Exactly. We're just trying to get through this stressful unknown.
Mm-hmm.
Where no one likes the unknown.
I guess if people comment on the YouTube, you can try and answer those, but except for trollers, I don't like trollers.
Yeah, there's a lot of those too.
So,
yes, Chris takes care of them on Facebook. So don't.
I'm not perfect. Chris.
Definitely.
Of course, yes.
And
But
so
we'll make mistakes. We can't keep up sometimes all the information. Sometimes we try to keep up best we can. But I mean,
right? People just gotta be rational. People just gotta understand it's a new situation. Doing the best you can. Both of you.
Don't be negative. Just help. Try to be proactive.
Yeah.
If you're gonna give feedback about something you didn't like, try to be proactive and tell us what we could do better. And
Yeah.
sure, I bet a lot of people can say, why aren't you guys doing this digitally with 3 different FaceTimes? And I think we just couldn't figure it out.
Yeah.
So
There's not so much in the budget we got.
So I don't think we should. Yeah.
So
This is
we're
not
in
a
the-
good example. We probably shouldn't be here together. And I recognize that, but we're trying the best we can.
Yeah.
6 feet away, and
We're doing what we got to do.
getting out of
We're,
here,
we're in the
so-
triad here.
Yeah, exactly.
so-
We're in the World War II bunker that is mud and water. So
yeah,
go figure. Well, thank you guys.
yeah.
Thank you for doing it. Yeah.
Dr. Chisti.
No,
Pachi.
yeah.
Unreal stuff. We're gonna leave this open to comments. So, like you said, any other questions on there, feel free to add in there, and we'll be happy to answer them. No trolls, or Pachi's gonna punch you.
And order food locally. I mean,
Order
literally
food locally.
look up what's
Yes.
open,
Yeah.
and order from them. Try to
Exactly.
support them, because if you're worried about the people with temporary jobs, like keep putting them to work. Not
Exactly.
Yeah.
That's
people
all I
can
gotta-
actually work from home,
Yeah.
which really sucks because it's like a white collar, blue collar thing almost. And so but some people are not financially affected as much
Yeah.
by it.
Right.
I mean, obviously 401ks and stuff like that are in the plumbing end, but not even everyone has a 401k. But try to support local.
Just try to
Yeah.
support it
So-
whatever way you can
so-
with the position in life right now.
Mhm.
That's really it.
Yeah.
So, special edition. Thank you, gentlemen. We're gonna get out of here before we get bombed. We haven't gotten whiskey yet. We're gonna go get whiskey now.
That's right.
Sleep time's over.
Buy
away from
ourselves.
each other. Buy
Buy
ourselves, far
ourselves.
away from each
Yeah,
other.
I'm peacing out. So.